Hi there. All right, is everyone so excited to hear about ethics? Okay, I'll also start with a little introduction just because, oh, you know what, I don't have the clicker. There you go. Okay, sorry. There wasn't a prep for this one. So I'll start with a little introduction because like this wonderful speaker before, the one before me, which was also wonderful, thank you. You might think, why should I listen to you about this topic? Am I the authority on ethics? No. I will say hello, that would be good. So who am I? I'm a parent, that's 2 out of 5 represented right there. I have a background in a myriad of things, mostly failures. Was wanting to start out as a neuroscientist, decided that wasn't for me, went to be a therapist, was told that wasn't for me in a gentle way because it was really difficult to separate sort of the emotional baggage and trauma of trying to help people and taking it into myself. So kind of wandering through life, figuring out what was the next place, and wound up most recently doing a passion project, which was a startup using empathy AI and trying to help young people, Gen Z, with mental wellness. And I don't mean necessarily therapy as a former therapist, to be careful. It's really just about betterment and empowerment and the superhero within, if you will, unlocking that. But AI can be tricky. So most of us, this is healthcare 2.0, I'm assuming have some overlap either in our daily life, in our practice, if you're a clinician, with AI. So one of the things that made me think about when I was given this topic was, what are some of the things around AI that we should just sort of make sure we pay attention to, but not to be so much a lecturer, even though I'm at the podium. Thinking about what are some of those key things as we get excited about all of the innovation and all of the power that comes with major processing that goes beyond what our brains can currently do. What are some of the things that are sort of trending, that are topical, maybe risk watch-outs, and what can we do about them in our daily practice? So I'm going to talk about 3 things. What is it, in terms of the definition I'm bringing you today? Why does it matter for any one of us, regardless of how you're doing your professional life? Most of us are living and breathing as we are in this room, so it affects us because most of us have some kind of interaction with healthcare, whether we are the patient or the provider, or the loved one or friend or family member. And the third is, looking at some of the companies and people that are leading the change and the charge around balancing some of the benefits of AI with some of the dangers. Okay, so we're going through a big shift. One of the things I wanted to do, because this topic is so juicy and exciting, is make it hopefully a little bit interesting or get a piece of your attention. So I thought I'd start with an idea of what is human versus AI. So I was just curious how many people in the room have any experience or understanding with the Marvel Universe, or your children, or have heard of Iron Man and those guys, right? So most of us. And I thought it was a really interesting thing to think about. What is AI versus human when you think about this, allegory? And if you don't know, there's a character. He was a butler, I guess, of sorts, very lovely. Of course, he was English, so that meant he was very smart. That's a joke. Called Jarvis, and he was the helper, if you will, to Iron Man's father. And over time, as a gift, they were able to download his consciousness into an AI that became the helper for Iron Man, giving information, giving advice, powering his suit, all those things. And then, of course, at one point in one of the movies, and bear with me, I'm not going to go through every one, this AI was in the wrong hands, right? So it was used for evil. So that same benevolent, helpful AI became the force of destroying the universe. Okay, but of course the hero saved the day, and it's back in the hands of the good. Now you transition to later in another movie, because of course the franchises will be going on well long before I'm after the stage. There will be many more Marvel movies, I'm sure. Became downloaded into the body of, into a vessel, into a body. And then over time, that body became a man that had a girlfriend, wife, and even became a parent. They didn't exactly explain the mechanics to the audience of how that worked, but we'll just assume most of you know about the birds and the bees and hope for the best there. So anyway, what is this Jarvis then, who later became known as Vision? Is it a person? Is it an AI? And what is that? And it really does kind of make us just think about those lines. If we're trying to mimic human, especially in healthcare, decision-making, what do you want those decisions based on? Do you want them based on only the statistics available at hand on, disease incidence, and here's a treatment paradigm, and this fits the mold? Is there a human factor, and how do you define it? So that's just sort of the impetus of where I started. So essentially, we know that AI can improve healthcare in a lot of ways. There's efficiencies, there's safety, there's a lot going on, right? But there's also some dangers around some of the bias. And some of that bias might be in a socioeconomic level, it might be in gender, in race, and all kinds of things. And kind of like whoever of you heard the speaker yesterday spoke about some of the challenges with tech and seniors, and how the seniors are having some trouble connecting with or utilizing some of this tech that was built by young people, quite younger than them, who don't necessarily understand or had considered some of the usability and nuances that they need. Well, it's the same with AI. The algorithms, AI just didn't spring into being, right? It was created by humans, by a certain subset of the human population who put in, subconsciously or consciously, their own sort of lens on the world in terms of the rules that it was training the AI to do. So unfortunately, that leads to a bit of bias. Oh, this is also super exciting stuff here. Let's go into definitions. So I just also want to review in the ethics area, what do we mean? So some of you are clinicians and some of you are not. It doesn't really matter. Most of you are familiar with sort of the 4 tenets, the oath that you take, right? So what are they? Respect for autonomy, beneficence, non-maleficence, and justice. So these are the sort of medical practice ethics, 4 points, right? So they're kind of obvious for this room. Individuals should be able to make their own decisions. Sorry, I'm trying to advance my slides. Beneficence is sort of, the moral obligation to act in the best interests of others. Non-maleficence, obviously don't harm anyone if you can. You're trying to always do what you can. Ideally, not kill if you don't need to kill, those kinds of things. And justice is the one that's sort of maybe the most vague if you're not a clinician yourself. It's really about distributing benefits and assets to care equally and fairly. And so therefore in a just way. So those are in medical practice. But in health tech, we take that and we kind of take it to another level. So we're talking about the guiding principles of what you're deciding that AI is going to do for humans. So that's really important, right? We're also talking about, these expanded capabilities, but now we have responsibility with that expanded capability and to not kind of lose sight of that. And the last one is the judgment call. So at the end of the day, who decides? Who decides who gets to terminate a life? Is it the AI only? Would you want that for a loved one if they were, an AI determined that it was time to pull the plug, for lack of a better glamorous way to put it? Or would you want a human involved in that decision? And what does that look like, and who decides where there's human interaction and where there isn't? So I'm just going to pick a couple things from the headlines in a moment to kind of talk about that are topical. But, really it all comes down to this. Not forgetting that we're talking about humans, so that we're all people, and just as you said before, which was really great, we all bleed red. And so that's sort of that delicate balance, and I think we get so excited about all of the innovation that we can do, we sometimes lose that in the headlights. So, sorry, some of the questions that I guess we're trying to answer have to do with how can we push the boundaries of what we can do today with tech in terms of getting access to care, getting access to treatments, getting insurance companies to determine that it's worth it to pay for something. When you can kind of show longitudinal models through AI to say, well, you know what, if you invest in preventative care, this will save you down the road. If someone just says that, it's kind of difficult to prove, or they say, well, you're biased because you come from Pfizer, and of course you want us to pay for this treatment and these medicines. So AI can help kind of level the playing field in some of those decision makings. How much should patients have how much say should patients have in this? So when we talked about yesterday a lot of the electronic health records and how patients should have access to their own information, well, do you want to have a say? Most of you go into, especially when you are the patient, regardless if you're a clinician, do you want to have a say? Do you expect to have a say in your treatment decisions? And what kind of information and access do you want to have to know why your clinician is making those decisions? This goes back to the insurance companies. Because of the fact that now everything is recorded and every like that you click on in social media and everything in your electronic record, every medical procedure you have across doctors, across hospital systems is now recorded, and it can paint a picture of you and your health and your future and your family's health. So it's another interesting area to see, like, who has control over that? Who decides what happens with that? And ultimately, that relationship between the clinician and the patient is impacted here as well. Because the more you empower the patient, you can't take away the clinical training, the medical expertise, that there's a differential there. But at the same time, there may be things like the gentleman who spoke about had surgery on one leg and then had pain in the other leg years later, but the technical data, the system, the AI that was reading his predictive plan was based on the wrong leg because he wasn't able to input the new information just because the fields wouldn't allow it. So where do we start? We start with the basics. Number one, the first principle, the first thing in the Hippocratic Oath, right? Let's try not to hurt anybody. Sounds kind of lame and obvious, but if you start there, it's a great way to think about what your systems are doing. And again, this is a combination of things, whether you're talking about designing an AI system or imparting it into software that you use in your business, or as a clinician for the tools that you rely on to make treatment decisions. There is a lot on LinkedIn that I think is really great. There are a lot of people who are outwardly sort of speaking about essentially giving away for free tips and tricks on really great advice on how to kind of get going. And one of them is a gentleman by the name of Reed Blackman, and he talks about, instead of making your ethics statement, which is really where a lot of companies start, right? If you're an AI company, you say, what is my policy? We work with IEEE in my startup around ethics and fairness and empowerment, right? You start with a statement. We will do no harm. That's your commitment. But what he suggests actually is to also talk about, what do you want to make sure never happens? Like, really be honest with yourselves, with your company, with your variables that you're thinking of. What do you want to make sure never happens? And we're not talking just data breaches. We're talking about, what do you want to make sure doesn't happen in terms of someone getting the wrong care, someone getting the wrong information, someone's life being further altered or ended because of that? What do you want to make sure? Some group being prejudiced against? So when you start with what you want to make sure doesn't happen, and then you build the steps on how to make sure that doesn't happen, that's the way to build your step one ethics statement. So this is what we stand for, and this is what we were sure that we will make sure doesn't happen to our patient populations because of what we believe. Within that, once you have your statement, right, I spoke about acknowledging the bias and the access challenges. So again, AI isn't perfect. There are many people in this room, in other rooms, who could probably speak to why bias happens much better than I could. But it's just important to acknowledge it, to be aware, so that you can predict and anticipate it before it happens. I'm going to just skip this for just a second, but essentially we're going to focus on this balance of improving fairness without sacrificing what you want to get out of it. So I like to look at the headlines a bit. So I'm sure many of you have heard about this woman who was a whistleblower at Google. I have several articles here about whistleblowers, including Theranos, right? So unfortunately, it often comes to the fact that it's even a whistleblower to bring this to light, is someone who decided to step away from a major job, publicity, money, security, corporation, backlash, all the things that happen to a whistleblower that aren't good. So they take a lot of risk. So it must have been, pretty viscerally bad for them to risk that and put their name out there. And she actually did lose her job for speaking up about Google and about, I think most of you in this room have heard of Google, right? So we're talking about a pretty big AI system. And she said, no, this isn't right. You're doing this wrong, Google. You know, you're marginalizing people. There's racism, there's prejudice of all kinds here, and we need to do better. And you know what they said? They said goodbye. So the good news is, though, that amplified and elevated her voice, and she is now a champion for helping to uncover and unlock bias. So there's a lot of good news in the industry, and I think we can look to these folks who've really worked in the depths of the largest language libraries that exist and decide to kind of take the risk and use ethics to lead. And she's widely successful today, and she's started organizations that have now helped change the world and be a little more inclusive for everyone. In the unequal access to healthcare, sorry about that, we basically can look to explainable AI. So what does that mean? There's a lot of ways to fix bias. I apologize. I told you I didn't have this all prepared. This isn't a sales speech. This is a nerd topic. So essentially, it's okay to say we don't have the answers and to look to other leaders and other institutions and organizations. For example, I spoke about IEEE. There's a lot of organizations that essentially will help you, give you the structure and the framework to make sure, rigor testing for your AI to make sure. And so that could be for when you're bringing on a new technology into your practice, for example, to ask these vendors, can you tell me about the ethics in your AI? Like, how do you allot for this? And if they can't answer that, then you know that might not be the partner for you. So another area, there's only 3, so don't worry. The other area is to think about the data collection and how we have ethical standards within that. So there's a lot of AI behind how we collect the data, what we do with it, right? And what we do in terms of privacy. Most of us in this room are pretty well aware of HIPAA and all the rules around PII, and that's all great, but there's not really anyone checking the box until often there's some giant problem, some data leak, some data piracy. So essentially taking on that rigor is essential before it happens. And to make sure that, again, when you look to your partners, your EHR systems, everything that you're doing, a lot of folks have patient portals and systems that manage all the communications with their patients, and ask them from the beginning, what are you doing with my patient's data? Where is it being stored? How can you tell me that it's being secure? Who has access to it? What happens if there is a breach? Where does it go? Are you selling this data in aggregate form or not? It's in the news. It's in the news because all of us in this room have our own PII data, probably in many places you wouldn't think about. And that could be in a number of ways. And it doesn't necessarily mean literally at the healthcare provider's office. This can be in a number of other ways. Anytime you buy a vitamin, a supplement, click on something on a social media that you like, this is all there, and it's building a picture of you to the world and your data, and it's being sold every day. So it's really, really important to think about it, whether you're the clinician or the patient, to kind of take that moment of pause. Another area that is in this line has to do with, someone spoke about this also the other day, in terms of data collection that's not even obvious. Whether you're cognitively impaired and you're giving out, this is, I'm sure most of you have heard of the digital pills, where there's a sensor to tell you whether or not the person has ingested the pill or not and what's going on. Some people, especially if there's a cognitive impairment, aren't even aware of this. And some of that may be other diseases where we have Alzheimer's and things like that, where the person is not necessarily able to make their own treatment decisions, but even if you are, there's a lot behind that kind of intimate information about what's going on in your body and who gets to know about what that is. It's just something that I think 10 years ago or 20 years ago, nobody even thought about. When we thought about adherence and compliance, we thought about reporting to your doctor or maybe looking at refill data as a way to understand compliance. Now it's, well, I see this, this compound was ingested on this day and on this time. That's great, but it's also quite a bit of information to have out there. And the last one is really this thing about human in the loop, right? That balance of the AI and the human, and using the predictive, amazing capabilities of AI with some kind of human intervention in the end. So essentially, we're talking about the boundary, right? Where is the physician or the clinician end and begin with the AI? Is there some way to sort of be in tandem? So as I was saying before, thinking about maybe someone at end-of-life situation and that balance between who is ultimately responsible for a decision around treatment or care. And how comfortable would you be with an AI making those decisions for you without a human in the loop? And that's kind of where we're moving. So just really thinking about how to make sure that there's always some kind of balanced approach. This was something I kind of stumbled upon late at night when I should have probably doing something better and more important. But I thought it was really, really interesting. And it was a young student at Berkeley, undergraduate, I believe, who decided to kind of, for a laugh, pretend that he was giving out self-help advice on these blogs using an AI language library that he basically got access to through a grad student. And he made up headlines and then had the AI generate an article that went with the headline. And he got to the top, these articles that he sent out, as if it was from him and a person, got incredible responses. And in fact, people were like, this helped me so much, thank you so much. And the irony also was that there was actually someone who pointed out, hey, I don't think this was written by a human, I think this was an AI. And all the other posters like jumped on the person who said that it was an AI and said, you know, how dare you, and you're breaking the spirit of what we're here for, and all that. And so it made me think, like, well, is it really bad if it helped people? And is it more about, you know, or what, and what's bad about it? Is it that he didn't disclose that it was an AI? So that comes back down to like the customer service presentation we had around, you know, that there's an AI and a chat bot. And I was just wondering, you know, about the audience for you to think within yourselves, because I wrestle with this as well. If the AI is right or helping, does it matter if it was a human who had that decision or not? Would it matter to you to know the difference if it was a human or an AI or not? And so these are the questions that we don't have any regulations for right now, currently. And a lot of these things are going to go before the government and become sort of policy in terms of, do you have a right to have a human involved? Do you have to disclose if this was a human or an AI that happened to make this determination? So it's just kind of interesting pushing the envelope, and also the way that, you know, we can all be kind of fooled, the whole deep fake thing. I mean, it's just getting more and more prevalent, and honestly, harder and harder to tell. I already said that. I'm going to end with a couple of these articles that are coming. So I talked about having a human in the loop, and I'm going to just close with this, because I'm tired of hearing myself talk. We basically have a lot of examples of challenges in the industry and in the marketplace around tech essentially going too far. And too far meaning that they go beyond our comfort zone, our physical healthy zone. And that also, when there's no human in the loop, I feel like there's a sense of a fear of a lack of accountability. Because essentially, we hope that we're all sort of answerable, especially those who are providing care, to do best, to do right by people. The AI, by nature right now, is devoid of those emotions, of those ethics, of those principles, and they are just going about, and I'm oversimplifying this, of course, the facts. So really just looking at that within the treatments that you decide to do, the vendors that you partner with, I would encourage you to do that. And I just want to end with, so ultimately, we're talking about these constant challenges, and that there's a lot of good work being done, and there's a lot of leaders to look to who are doing amazing things and also kind of taking a big risk by going against their parent companies, if you will, and saying, this is really great, but we need to take a step back or do this here. And it's a little harder, but I think it's really worth it, and it's the time to start asking these questions of your own systems that you work with every day, just because it's easy to lose sight of that, because technically, you know, the AI is better than us, right? It's better at making a decision. It has more information, it has more data, it has more speed. And again, just lastly, I didn't want to go too much into the Theranos example, and I'm sure most of you have seen the Theranos, and if you haven't already, you know, and there's a Netflix special and all that. But once again, just like with the Google example, even in these sort of negative examples or shock and awe factors of like, oh my goodness, how did that happen, and how do we get away with that? If we strip that away for a moment, there are some good things that have come out of the spotlight being drawn on ethics, and one of them is some of the folks from the Theranos have now gone on to become ambassadors for ethics, so the watchdogs, if you will, and they've come and they've seen what the damage can be from the inside, not the sensationalized headlines, but they see the damage to people's lives, livelihoods, and, you know, basically life. So at the end of the day, obviously this is a big part of the discussion. That's why I was given this luminous topic. I know that in our startup, it's a very, very important part of what we try and balance with the technology and the tools that we have. We are trying to be inclusive to all people, and that means all socioeconomic status, all ethnicities, all religions, and all of that. And it's really difficult when a lot of the tools weren't built by people who represent all of those things. And that's it.